Thank you for your questions. We've had a large number of questions that have come through to us here at Elite Aesthetics about tear trough filler. So I'm going to answer the top 6 questions. The first one is, what is used, a needle or cannula? So both techniques are very, very acceptable in correcting a tear trough. In certain conditions, a combination of needle and cannula are used, but for all intents and purposes, I would say 9 out of 10 of my patients actually have tear trough corrected using the cannula technique. The next question was, does it hurt? So we try as hard as possible to apply some kind of anesthetic. So in some cases that is a topical anesthetic, it's in the form of a cream or a gel. In other instances, we can give a little bit of local anesthetic to the area where the cannula will insert into the skin. It's usually in kind of this part of the cheek on either side. Once the cannula is placed through the skin, it goes into a layer of the skin where there aren't a lot of free nerve endings. So what the patient will feel is the sensation of something underneath the skin, but not necessarily of any pain. The fillers that we use do contain lidocaine, which is an anesthetic. If a patient is, for example, allergic to lidocaine, we will not use it, but for most patients, they will get filler with lidocaine in it, and that provides enhanced patient comfort during and after the procedure. So the next question is, do you bruise? You can bruise with any injection into the skin, no matter how careful the injector is. There's always the possibility of bruising or bleeding. There are many millions of free vascular endings in the skin, so if you nick one of them, there is a likelihood that a bruise may occur. So irrespective of how experienced your injector is, they cannot always rule out that there will be no bruising whatsoever. Is there any downtime? Generally not with tear trough fillers when done with a cannula, for example, and if there are no complications that have happened during the procedure, patients can return to work and resume their life immediately after the procedure is complete. That being said, there is a very small percentage of patients, the swellers, we call them, or patients who have poor or slow lymphatic drainage in the area around the eye. What we find is, by virtue of the procedure itself and also by placing of the filler within the tear trough, you find that they sometimes get a little bit of swelling, and that takes a few days, sometimes up to a week, to settle down. The next question is, how long does it last? So a quick rule is, in 2 areas of the face, we have dermal filler lasting the longest, and the reason for that is because these are areas of immobility. One of those areas is the tear trough. You're looking at the filler lasting on average 12 months or more. Some patients have even reported their tear trough filler lasting as long as 24 months. The other place in the face, just for your information, where filler lasts very long is if you have a non-surgical rhinoplasty. The next question is, why do we not use Juvederm? So brands are quite important when choosing filler, and when we say brands, we mean the entire range of products within a particular range. It is my experience that we do not get a very good result using certain types of the Juvederm range. Juvederm is an excellent filler, but in my experience it is best used in other areas of the face. I achieve excellent results in tear troughs using these 2 fillers, which is Redensity 2 and the other one is Stylage S, both of which have vitamins, minerals and antioxidants in them. So the longevity of the filler, the gel is protected, it lasts longer, and we get a better and smoother result, which I find does not happen with other